My name is Raymond Anagabong and my student ID 25019 is 8542. So today I want to present about self-awareness is essential for accurate judgment and effective decisions making in physiotherapy practice. For the introduction, physiotherapy practice requires healthcare professionals to make informed clinical judgments that influence patients' recovery, functional outcomes, and overall well-being. Effective decision-making is not solely dependent on technical knowledge and clinical skills, but also on the ability to critically evaluate one's own thoughts, actions, and assumptions. This ability is known as self-awareness. Self-awareness enables physiotherapy students and practitioners to recognize how personal belief, emotions, experience, and limitations may influence clinical reasoning. By promoting objectivity and reflections, self-awareness supports critical thinking and reduces the likelihood of errors in judgment. Therefore, self-awareness is considered an essential component of professionals' competence and evidence-based physiotherapy practice. Strategy in critical thinking. Developing reflective awareness. Self-awareness is strengthened through reflections on clinical experiences. Reflective thinking encourages physiotherapists to examine their decisions, evaluate outcomes, and identify areas for improvement. For example, after managing a patient with post-stroke impairment, a physiotherapist may reflect on whether the chosen interventions were appropriate and whether alternative strategies could help produce better outcomes. This process promotes deeper understanding and enhances future clinical judgment. Critically, reflections is beneficial only when practitioners are honest about their weakness. Superficial reflections may fail to identify errors and therefore limit professional growth. Analytical evaluations of clinical information. Critical thinking requires physiotherapists to analyze patient information systematically rather than relying on assumptions. Self-aware practitioners actively evaluate assessment findings, patient history, and diagnostic indicators before making conclusions. For instance, symptoms such as dizziness and balance problem may initially appear most clinical in nature but could indicate neurological involvement. A self-aware physiotherapist is more likely to question initial assumptions and seek further evidence before deciding on treatment. Recognition of personal limitations. An important strategy in critical thinking is acknowledging professional limitations. Self-awareness helps physiotherapy students and practitioners recognize gaps in knowledge, skills, and experience. Rather than attempting to manage complex cases independently, self-aware clinicians are more likely to seek guidance, consult colleagues, or refer patients when appropriate. This demonstrates professional responsibility and contribute to safer patient care. So, for continuous learning and adaptations, healthcare practice evolve continuously as a new evidence emerges. Self-aware practitioners understand that competence requires lifelong learning. They regularly evaluate whether current practices remain effective and are willing to modify treatment approach based on new evidence. This adaptability strengthens critical thinking because it encourages practitioners to question outdated assumptions and embrace innovations in clinical practice. Barriers to critical thinking. Emotional influence on clinical judgment. Emotions can significantly influence decision making. Physiotherapists may develop strong emotional connections with patients, particularly those undergoing long-term rehabilitation. While empathy is important, excessive emotional involvement may affect objectivity. For example, a practitioner may continue ineffective treatments because they feel personally invested in the patient's progress. Self-awareness helps identify emotional influence and maintain professional judgment. Confirmation bias. Confirmation bias occurs when individuals focus on information that supports their existing belief while ignoring contradictory evidence. This bias can lead to inaccurate assessments and inappropriate treatment decisions. Although self-awareness self-practitioners recognize this tendency, completely eliminating bias is difficult. Therefore, critical thinking requires deliberate efforts to consider alternative explanations and viewpoints. Dependence on routine practice. Experienced practitioners may become accustomed to routine methods and rely heavily on familiar treatment approach. While experience is valuable, excessive dependence on routine can reduce critical analysis and innovation. Self-aware physiotherapists continually question whether routine practice remain suitable for individual patients rather than assuming that previous solutions will always be effective. What the lack of confidence among students? Physiotherapy students often lack confidence due to limited clinical experience. This may discourage them from questioning decisions made by supervisors or contributing their own ideas during clinical decisions. However, self-awareness and help students recognize that uncertainty is a normal part of learning encourage them to engage actively in clinical reasoning progress. So, how cultures influence on professional perspective? Every healthcare professional is influenced by cultural values, belief, and social experience. This factor shapes perceptions of health, disability, and rehabilitation. Self-awareness enables physiotherapists to recognize how their cultural background may influence clinical judgment and help prevent personal belief from interfering with objective decision making. How to understanding patients' cultural context. So, patient attitudes towards pain, treatment, and recovery are often shaped by culture. Some patients may prefer traditional healing practice, while others may have specific religious or family considerations that influence healthcare decisions. Self-aware physiotherapy consider this factor when developing treatment plans, ensuring that care remains respectful and patient-centered. Communication across culture. Effective communication is essential for accurate assessment and treatment planning. Cultural difference may affect how patients describe symptoms, express pain, or respond to healthcare professionals. Through self-awareness, physiotherapists can adapt their communication styles and avoid misunderstanding that may compromise clinical judgment. So how to promoting inclusive practice? Critical thinking involves considering diverse perspectives rather than relying on a single viewpoint. Cultural awareness broadens understanding and encourages physiotherapists to approach clinical situations with greater flexibility and openness. As a result, culturally inclusive practice contributes to more accurate decision making and improve patients' outcome. So, for the conclusions, self-awareness is a critical factor in promoting accurate clinical judgment and effective decision-making in physiotherapy practice. By supporting reflection, analytical thinking, recognitions of limitations, and continuous learning, self-awareness, strength, critical thinking among physiotherapy students and practitioners. Nevertheless, barriers such as emotional influence, confirmation bias, routine practice, and lack of confidence may hinder effective clinical reasoning. Furthermore, cultural factors shape both professionals' perspective and patients' experience, making cultural awareness essential for patient-centered care. Ultimately, the development of self-awareness enables physiotherapists to make more objective, evidence-based, and culturally sensitive decisions, leading to improved professional practice and better patient outcomes. So thank you for hearing my explanations.